Okay, so today I want to talk to you a little bit about the current healthcare system and why it'll never work. The biggest problem with the current healthcare system is, you know what? First of all, we're paying a lot of money, right? Everybody's insurance prices are going up. Your deductibles are going up. Your co-pays are going up. It's really hard to even pay for healthcare in the United States. Well, the problem is we're not paying for health care. What we're actually paying for is disease care or crisis care, and it doesn't work by design because it's entirely based off of how you feel and your symptoms, right? So the problem is that if you feel bad, you go to the doctor. If you don't feel bad, then you must be healthy. Well, let's think about this. Number one cause of death in the United States based off of the CDC is heart disease. Okay, what does heart disease feel like? Well, it doesn't feel like anything until you have the symptom, right? You know, they say he walked off the 18th hole, he was healthy as a horse and he had a heart attack. Was he really healthy? Until he took that one step, all of a sudden his health changed? Or possibly has his heart been getting sicker for years before it finally stopped working? The first symptom of heart disease is usually heart attack. 50% of the time, the first heart attack is the one that takes you out. So 50% of the time, the first symptom of heart disease is death. That's not good. What about stroke? That's the number 2 cause of death in the United States. What's the first symptom of stroke? It's stroke. By the time you have it, it's too late. Cancer. What's the first symptom of cancer? I don't know. But you know, in order for it to even be visualized on an x-ray, it's been there for 10 years. Growing inside of you for 10 years. So you've been sick for at least 10 years before you start to develop cancer. Same with diabetes. You've been sick for years before it actually shows high blood sugar. Okay? The pancreas have been getting weaker and weaker and weaker until you get to a point where finally symptoms start to show up and then all of a sudden it shows up in your blood. So basing health off of how you feel doesn't always work. You know, let's talk about symptoms for a minute. You put your hand on a hot stove. Why is that? What are you going to feel? Pretty quickly, right? Some pain. Why do you feel pain? That's your body saying, hey, dummy, move your hand, right? Symptoms are there to protect you. It's there to tell you, hey, there's a problem. So when you go in, you cover up the symptom, all you're doing is masking the problem. I mean, do you think headaches? Let's look at headaches. Do headaches come from a Tylenol deficiency? Okay, then why do you think taking Tylenol is going to fix the problem, or is it just going to mask it temporarily? While the pain's still there, the problem's still there. It's like waking up at 2 o'clock in the morning and going and unplugging the fire alarm and going back to bed. Is that going to fix the problem? No. So nobody's ever had in the history of mankind a drug deficiency or too many body parts. So taking drugs will never fix any problem. They might mask you. Mask will make them feel a little bit better while you die. And nobody's ever had too many body parts. So cutting things out aren't going to fix it. So where does health come from? If it doesn't come in a pill, potion, or lotion, where does it come from? Health comes from within you. You have a power within you that heals you. Let's think about this. If you cut your hand, what do you have to do to it to heal? Nothing, right? Keep it clean, leave it alone, and it heals itself. What does that? It's an innate intelligence. It's called innate intelligence within you. It's the power that made you. The power that created you is also the power that heals you. You think that only works on the outside? It works on the inside too, but this is the problem. That message, that power, that innate intelligence can be interfered with. It can be interfered with, meaning you don't have the full healing potential you were born with. And how does that happen? There's one place in the body, only one place, and that's the top of the neck. A bone can be out of a line there to the point it can interfere with the power that made your body, traveling through the nerve system, and interfere with your body's ability to maintain itself, to regulate itself, and heal itself. What does that mean? Well, it can affect your digestion. It can affect your immune function. It can affect respiration, your lungs. It can affect your heartbeat, your blood pressure. You can affect anything, any function in your whole body because the nerve system controls everything. Think about this. If you took your kidney and cut it out of your body and laid it on the table, what's going to happen to it? It's going to die. Why is it going to die? Because it doesn't have enough blood? Put it in a bucket of blood. Your own blood. Was that going to save it? what's going to happen to it? It's going to die. Why? Because it's disconnected from the source. What's the source? It's the nerve energy, the innate intelligence that travels through the nerves. If you can take that kidney and you can pull it out of your body, as long as it's still connected to the nerve, it's still alive and it still maintain itself and still live. But as soon as you disconnect it from the nerve, immediately it starts dying. Now, that makes sense. It's easy for us to understand you disconnect the nerve, but what if you disconnect the nerve, but it happens up here at the top of the neck? What's going to happen to the kidney? If it's the nerve that goes from the brain to the kidney, here's disconnected, it's still going to die. It can be disconnected like stepping on a garden hose, but only in one place, and that's the top of the neck. It can interfere with the messages from the brain to the kidney, or to the heart, or to the stomach, or to the lungs, or anywhere else in your body. If it gets disconnected, it doesn't get the full life, then it starts to function at less than full life, meaning it's starting to die. It's going the wrong direction. This can affect any part of your entire body. We don't know what part. The only way to know if you have a misalignment that's diminishing the life from your brain to your body is to get it checked. How do you get it checked? You go to an upper cervical doctor, somebody who specializes in the upper bones of the neck, and they can look at you, do an exam, an evaluation, determine if you have a problem here that could be causing your health to diminish, could be interfering with the messages anywhere in your whole body, or could be affecting your whole body as a whole. The only way to know is to get checked. Now, realize this. You might be thinking, well, but I don't have any neck pain. The brainstem doesn't have any pain perception. So you could have a bone out of line here. Could be cutting off the message to your heart. Your heart could be dying right now without you having any neck pain. Okay? It could be affecting your children, your spouse. We don't know. The only way to know is to get it checked. Now, at the Upcervical Spine Center, we have a free consultation. We never charge for a consultation, just to find out what your needs are, to see if you might have an upper cervical problem. If you do, we're going to explain to you that, and we're going to teach you what we need to do to try to fix it. If you don't, we're going to tell you that too, and we'll keep looking. We'll find somebody else that can better serve your needs. If you don't live in the Charlotte area, then find an upper cervical doctor near you. Do a search online. If you can't find one that way, call our office. We'll try to find one for you. But if you do live in the Charlotte office, call the number below. Let's get you in. Let's get you checked out and see maybe you might have something that's interfering with your God-given ability to be well, stay well, and live life to the fullest. As we say, not only can we add life to your years, but years to your life. You don't want to just exist. You want to live to the fullest. Come on in. Let's check you out. Let's see what's going on. See if there's some way we can improve your life. Give us a call. Look forward to seeing you. Thanks for tuning in. Check out our website, learn a little bit more about upper cervical, but let's get you in, get your whole family in, let's get everybody checked. Let's see if there's something that's interfering with your function so that it's not allowing you to live 100% the life you're supposed to live. I'll see you soon. Thanks for tuning in.